Hello and welcome to Q&A with CNA. I'm Kyle Schwartz and our guest today is Ashlie Lamp, and she's a qualified mental health specialist supervisor.
Yes.
Got that right?
Yes.
All right.
Yes.
Well, this is your first time on the program, so welcome.
Thank you for having me.
And so tell us a little bit about your background before we go into your job, but tell us a little bit about your background, where you grew up, went to high school, college, all that.
Okay. So I am a Starr County native. I was born and raised in Massillon, so not super far from here. Went to school all through high school at Massillon, graduated from Washington High School. I got my undergrad degree from Malone University in social work, and then my graduate degree from Case Western Reserve University in social work as well.
Okay. So how long have you been with child and adolescent behavior?
Just about 7 years now.
Okay, all right. And tell us about some of your roles that you had prior to being the supervisor now. Tell us some of the things you've done.
I have
About
done
everything?
lots of things, just about any job CNA has to offer. So when I first came in, I came in as a case manager. So I've done the job that I'm now supervising.
Okay, well that's important.
Yes. So I've done case management. I was a master's intern doing counseling. I have done prevention work, AOD prevention, and on the early childhood mental health consulting part of what prevention does. I've done therapy, office-based and school-based, and then worked my way up to what I'm doing now as a QMHS supervisor, and then also the case management coordinator. So overseeing like that whole program.
Okay, so tell us the difference so we can differentiate between those two, between a case manager and then a mental health specialist.
So they're pretty interchangeable.
Okay.
The role is pretty much the same. What I will say is our qualified mental health specialists do a lot more hands-on interventions and skill building and rehearsal of skills than what you would think of stereotypical case management.
Okay, all right. And how will a QMHS, a staff member, work with youth of various age ranges?
So they do lots of different things. When you're talking about that early childhood population, like up to 6, 7, 8, you're talking about a lot of working the parenting end of things, just helping parents learn how to manage and redirect behaviors, teaching those behavior management skills and strategies in the home.
That's a lot better at that age than later on, right?
Yes, yeah, we want to start that stuff early so that we can help teach the child different behaviors, and we want the parents to be able to manage those behaviors more so than having a provider come in and be the one to do that with the child.
Yeah.
Because we don't want them to be dependent upon us. We want them to be able to do it on their own and
in
empower
their own home.
them.
And
yes.
Yeah. Okay.
Yeah.
All right. And then what about for adolescents when they're 11 to 15?
So a little older and adolescents, we do a lot more skill building and rehearsal of strategies, teaching like anger management, social skills, conflict resolution, teaching healthy relationships. There's still a parenting piece to that, because regardless of what age the child is, the parent still has the most influence in that child's life. So we still work the parenting end and do like the home-based services even as the child is coming through adolescent and teenage years.
Okay. And then after 15, what do you hope to accomplish with that age group?
At that point, we're working those social skills, relationship building, because that is the point in time where kids start to pull away from their family of origin and move towards peers. So we want to help them develop those healthy peer relationships, teach them refusal skills so that they can resist peer pressure, because that's a huge one in those teenage years. We're still teaching coping skills, anger management, and helping to reinforce the skills and strategies that they're learning in therapy if the child is still with the therapist at that point as well.
Okay. All right. And how does your job change in the summer months? Is it any different how you work with the kids or whatever?
So I think summer months can be a lot more fun and free. We do a lot more community-based stuff, going into the home and doing those hands-on in the moment interventions with parents and kids, and then also doing like park visits. So
Okay.
sometimes we meet kids at parks and we kind of coach them through social engagement with peers on the playgrounds and things like that, meeting out at maybe McDonald's or something like that, and coaching through like how do we use these skills out in public and put them into real life practice.
Okay. How many people are on your staff?
We have 10 or 11 at this point, which we're still working on building the program. We would love to continue growing. So that is definitely something we're working on at the agency. And then 2 of us are supervising them at this point.
Okay. And how many clients? I'm sure, I mean, I know it varies every week and month or whatever, but approximately, do you have a?
Approximately, I would say right around 300, but like I said, we would like to continue building that
Yeah.
and serve more and more.
Because more and more need it, right?
Correct.
Okay.
Yes.
You know, one other thing about the summer, did you also work in conjunction with the Ys?
We do. We contract with a lot of the county Ys to provide behavior support, coaching staff on how to manage behaviors, just like we do with parents, because these kids spend a lot of time in centers like that through the summer while parents are working. Coaching the kids on the behavior, helping build those healthy relationships, and just learning all kinds of skills and strategies in those settings.
I think that's really important because, you know, in the schools, teachers may reserve or may get a little bit of training in that area, but like the Y, you know, some of those people come from not much of a background in working and helping out, and so that's probably really important, the training aspect for the staff, right?
Yeah, absolutely. We get a lot of, their staff is right out of high school and college, so it's very beneficial to have a provider in there teaching those skills and strategies that they might not learn just yet, or maybe that they've learned in school and they haven't put into practice yet. So just coaching them on how to be able to use those things.
Okay. All right, well, was there anything else that we skipped over or you needed to add?
I kind of just want to reinforce how hugely beneficial it can be to have our QMHS certs, some people call them case managers, involved with that skill building and that skill reinforcement. Even if they have a therapist, QMHS is definitely beneficial.
Okay, so how, what's the number they call or the website? How does somebody get in touch with you, your staff?
They can
whatever?
reach out to our child and adolescent office here in Alliance, in the Belden office, in the Plain office, and they will be directed where they need to be directed in order to get things started.
Okay. What do you enjoy most about your job?
I love my job. I feel like I have such a greater reach at this point because I supervise so many providers and they're on so many different cases. So I do have the opportunity to touch a lot more lives at this point than I did when I was strictly direct care.
Yeah. Okay. Well, you seem like you enjoy your job, and
I
you seem like
do.
you are very happy, and we're very lucky to have people like you doing what you do for our
Thank you.
community. Thank you, Ashlie. And thank you for watching Q&A with CNA. I'm Kyle Schwartz.